Hello, welcome to Balance
Oh,
Steps. I'm Dr. Cynthia Correa Cedeno. I am working out of Orlando, Florida, and this is my amazing co-host.
yes, my name is Dr. Sondema Tarr from Phoenix, Arizona, owner of Direct Podiatry, Arizona.
Direct Podiatry Arizona. And
Yep.
I am the owner, founder, CEO, CFO, COO, all the C's
All the
of
things.
Orange Sky Podiatry here in
Yes.
Orlando, Florida. And this is season 2,
Mm-hmm.
episode 4.
Mm-hmm.
It is from fragmented care to
Mm-hmm.
whole decisions.
Mm-hmm.
So that's a good one.
Yep.
You think as specialists that all we're supposed to do is kind of like work in a vacuum in a silo and just be like, all I do is foot and ankle. But
Mm-hmm.
remember, everything is connected. All of the systems work together. So with the way that we're practicing medicine and the model that we're in, we can tie all of that together.
Together. Exactly.
Mm-hmm.
Exactly. Like nothing happens in a vacuum in the human body. I think one of the most common questions I get are actually about toenails. Like people are
Mm-hmm.
very curious about their toenails. And they ask me, like, hey, my toenails are growing out like this. Why is that? And I'll explain to them, there could be 1,000,005 reasons why your toenails have changed. Like, how is your health if you have especially chronic health issues? Type 2
Mm-hmm.
diabetes is a big one that affects a lot of people
Huge.
in
Yeah.
this country. That definitely will affect how your nails grow out. If you have any type of deficiencies, iron deficiency, B vitamin deficiency, if you're not eating a lot of like protein, collagen in your diet, all those things will impact your toenails. So usually once I tell them that, you can see kind of the wheels turning and being like,
Yeah.
yeah. And then I pretty much have started telling people like, look, anything that goes on inside of your body, eventually it'll manifest in how your nails grow out at some point in time.
Yeah.
They show
And then,
everything. Yeah.
yeah, and then that is the system wide check.
Yes.
And then if
Mm-hmm.
we're going more localized, some people do have bone spurring underneath their
Mm-hmm.
nails, and then
Mm-hmm.
that can change the shape of the nail.
Yeah.
Also, your biomechanics, someone who has
Mm-hmm.
a more pronated foot is going to put more pressure on one certain side of the toe, and
Yep.
then you start to notice that the nail starts to change. There's also some
Mm-hmm.
people that hyperextended toes. What does that mean?
Mm-hmm.
Like hitchhiker toe before your thumb, I mean, sorry, for your big toe. And
Yeah.
then that's a constant area of pressure
Mm-hmm.
that keeps hitting the top of your shoes. And then that can change the anatomy of your
Exactly.
nail. And who knows, maybe you were a wrestler back in the day and you know that you guys weren't taking care of your hygiene like that.
Mm-hmm.
Sweating,
Yeah.
all of that microbacteria gets underneath. You're a teenager, you don't think about it. Now you're 35 and you're like, what's going on? My nail looks like a cornflake, you know?
Mm-hmm.
So it's like, okay, what is going on underneath this? Even that is complicated. And this is just dermatology, y'all.
Mm-hmm.
Only dermatology. We're not even
Yeah.
talking about the structure that you are sitting on, that you are walking
Yeah.
on.
Yep. So it's very complicated. So again,
Yeah.
nothing inside the body happens in a vacuum, and especially your feet. Like nothing happens just isolated events. Everything's connected.
Yes. So there's problems, like why just symptoms changing? Just chasing the symptoms does not help us see all
Mm-hmm.
of the whole entire process of why this came to be.
B. Yeah.
And people like to use the root cause, whatever, that's
Mm-hmm.
like the buzzword now, but really it's
Mm-hmm.
like why all of this came to be. Why is it that all of your systems that are great at regenerating itself are not working
Mm-hmm.
together and causing this problem?
Mm-hmm.
And as a specialist, that's our job to
Exactly.
understand what is going on with that foot and ankle, whatever issue it is in your system, and how all of these systems are working together. But it was very difficult, almost impossible for me to really work that way when I had to see 40 people a day because all I was thinking was about this very tiny thing, very tunnel vision, and just like this is a symptom and that's it.
Yeah. That's all you can really do, when you're given 8 minutes a patient and you have to times that by like 40 plus and then maybe you're like going to hospitals, you're doing like all these other things, and then you have to chart on those 40 people. It's a lot. Like, really, all you can do is focus on the symptoms, as sad as that sounds. But it's like people wonder why the healthcare system is the way it is in America today. And again, I always say this, it's not that doctors that are in that system are terrible people or horrible human beings. It's, once you're in it, you really have no other option if you want to stay in that system but to think that way. And that's what it is. The most well-meaning doctors, the most intelligent doctors, if you're trapped seeing 40 people a day, things will fall by the wayside. And that, like,
Mhm.
really getting to the why that person is sitting in front of you today, that's one of the things. You just don't have time. Yeah, you just don't have time. And it's not a personal thing. You really don't have time to
It,
get out of that system. Really allows you to open up and really get to the source of the patient's problem sitting in front of
yeah,
you, because you
yeah,
have time.
yeah, yeah, and it's fragmented and it's seen
Hmm.
that way. Like my part is this and your part is that, and you ask patients, I feel like I'm getting the runaround, and you kind of are,
You are,
and
yeah.
not at the same time,
Hmm.
because those are the systems that are put in place. Just an example that last week I removed an infected and grown toenail, but I was the fourth doctor that person
Hmm.
saw. They went to urgent care, they gave him oral antibiotics, and they said, um, you need to go to a dermatologist to get this removed.
Hmm.
Although the patient was well informed enough to say, "Hey, I thought a podiatrist would be the one," they said, "No, podiatry wouldn't touch this. You need
Hmm.
to go to
Yeah.
dermatology." So
Hmm.
then they go to dermatology.
Hmm.
Dermatology says, podiatrists will not touch this without an ultrasound.
Hmm. Oh.
Why? I don't know. So
Oh,
then they get
wow.
an ultrasound and they have a vascular surgeon
Oh,
read it.
okay.
And yet this ingrown keeps getting worse and worse. And this happened
Hmm.
last week. This is 2026
Oh,
in
yeah.
Orlando, Florida, in the United States of
Hmm.
America. Okay. And I was like, what? So this whole person got the runaround. They found me online. Um, and we got it all done that same day. And they were in shock. They were
Hmm.
a shooketh. That they were
That's a
like,
shame.
what? They were like, you can give me the antibiotics, remove this sharp tooth of a nail, because it was. I took a photo of it. I'm like, you won a prize. This is the biggest one I've removed in a while.
No.
I'm like that with my patients. I was like, oh my god, that was huge. And I get it, and they were like so many hundreds of dollars in and super
Hmm.
confused, and then they were paying my fee. They were happy ish
Yeah.
to pay it, but they were more happy that everything got done and I took my
That their problem
time
is
and
solved. Yeah.
yeah, and their problem were, they understood everything that was going on.
Hmm.
Um, but see, that's what happens. Care gets fragmented.
Yeah.
Even now, I mean, the dermatologist saying they need an ultrasound. I'm like, for what? I was like, I've never heard of that. And I know more of that confusion is out there, the more that things are fragmented.
Fragmented.
Uh,
Exactly.
yeah, but with this system, with the system that we can just take care of the whole, take care of that specialized part, because that is our scope of medicine, by understanding the whole.
Hmm.
And I have a group of physicians that I can refer my patients out to, because I'm not going to take care of their endocrine system, but somebody will,
Hmm.
somebody who has diabetes, like, I can live with an endocrinologist or a primary care, and we can all collaborate together
Together.
to help this person as a whole.
Hmm.
And now we have a superior care.
Yeah.
Now we can actually understand and help this person, because I alone can't find all of the causes, and I know that,
Yeah.
but we all have a very important part. It's
Exactly.
separated, but it comes together.
Together. Yeah. I think willing to work together too is important. And I think more doctors need to be more collaborative as well. Again, kind of like Dr. Cynthia said, especially as specialists, we are very focused on the foot and ankle. And yes, any health condition will impact your foot and ankle. But because we're not managing said conditions, it is in our best interest to, not to say turn you over to another doctor entirely when your treatment isn't done, when you're still having foot and ankle issues. But for example, my story, and I always tell this one, I had a patient last year who broke, I think, at least 4 different bones in her foot. She fell in her garage while moving. And she went to her primary care doctor. They didn't really do anything. She went to urgent care. They didn't do anything. And then finally, her husband found me. And so she saw me, and I saw her age, and, you know, assumed that more than likely she's gone through menopause. And I asked her, when was your last menstrual period? It had been a while. I asked her, have you ever had bone scan, DEXA scan to check for your bone density? She goes, oh no, I had one in Mexico, but that was it. I paid for it myself. My doctor didn't want to order one. And I said, that's a problem, because you slipped and fell and broke 4 bones in your foot. That's not normal, you know?
I was like, you're not a bird.
Exactly. You're not a bird.
Like,
Yeah.
I'm not seeing
Yeah.
a chicken in front of me.
Exactly. She had no other health problems. So I ordered a DEXA scan for her. I actually found a cash PCP that does, or her focus is on menopause care and getting women started on HRT, hormone replacement therapy, all that stuff. That is her bread and butter and like her passion. So by God's grace, I found her. She's 15 minutes from my office. I called her. She picked up my call immediately. We talked, we collaborated. I said, hey, I found a doctor that you can go see so that you can start hormone replacement therapy. She'll do all the testing, make sure that it's safe, but you need something, because today it's your foot, tomorrow it could be your leg, the next day it'll be your hip. And once, especially those bigger fractures happen, disability, all type of things, like just quality of life, if not worse, is gone. So again, you know, doctors being collaborative, and again, realizing the whole person. And when you need to refer out and work with another doctor to get this person better, because that's what it's about at the end of the day, then you do that. So
Yeah, and that would be whole decision care versus fragmented care. And I've heard the general public say things went wrong when we had specialists. I was like, no, because one doctor can't do everything. Like it's insanity.
yeah,
It just doesn't. It will not work. They
yeah,
will falter. That's why there are so many specialists, because
yeah.
our human physiology is that complicated.
It's
It
that
is,
complicated. Yeah. We need
but
specialists
we do need specialists, but we need specialists to work by
together.
making but together and being system thinkers and
Hmm.
thinking in whole decisions instead of just being in a silo. Because that's what I was. I didn't see, more than like if you have tarsal tunnel, that's all that's going on. Even though there's a
Hmm.
complexity, the tarsal tunnel, like this is the result of something else.
Else.
We need
Yeah.
to rule out all of these things as to why that is,
Hmm.
going on and where is it stemming from. So
Hmm.
that's how I saw it, as like specialists working in thinking of all the symptoms, working as seeing that person as a whole, but being an expert in that part of the body and collaborating with others. But to let one physician, it's like you might as well let your barber take care of you. Like if you think one
Yeah.
physician, one physician's
Yeah.
gonna do it all.
It's a little, yeah. And you know, there was a point in time, I think, especially in America, and even like some places today, like you go to
Barbers
rural
did,
America,
yeah.
exactly, where you have one doctor that did everything. You know, I grew up in rural Alabama, Talladega, if anybody knows where Talladega is. And the
Talladega
pediatrician,
Nights.
yeah, exactly, that
Oh my
Talladega.
God, Wolf Bear, Bobby, Ricky
Yes,
Bobby,
it's Ricky Bobby.
Ricky
Yes.
Bobby.
So Talladega is a real place, and I spent 5 years of my life there. So shout out to Talladega, Alabama, if anybody's listening from there. But
That's
yeah,
hilarious.
so
It just
exactly. Yeah,
Talladega
it's a real
Nights.
place. It's a real place. So again, Talladega is very small. It's a very small town. I remember the doctor that I saw and my brother saw as a kid, who was our pediatrician, wasn't like trained in peds. He was an OBGYN that came back out of a retirement because our town was so small, there was no practicing pediatrician. So the hospital board begged him, plead him, hey, we need somebody for these kids. Please come back and work. And he said, "All right, fine." I mean, he was a great doctor. He
Yeah.
honestly was my inspiration for becoming a doctor because he was so kind, so nice, so just hospitable. He knew his stuff, everything. My mom also loved him. My mom's a nurse and she worked at really the only hospital we had in our town in the ER. So she kind of knew like all the healthcare people in our town. Again, very small town. But you know, when you're living in that type of situation, you're living in rural America or like other countries, yeah, you've only got one doctor that's going to do everything. And that's kind of what it is. That's a
Yeah.
different situation. But when you're living in other places and you have access to specialists, you know,
Wow.
it's
Yeah. So
it's good to tap into those specialists as long as they're working collaboratively, working
yeah.
together. I think that's the thing to keep in mind.
And that's amazing. I mean, if you're seeing all of these specialists, just know that you're in a privileged class. You're in a
Yeah, you
privileged
definitely are.
you're in a privileged
Yeah,
area that you're
you definitely
seeing
are.
all of these specialists. I've never thought about it that way, but yeah, you're
Mm-hmm.
right. Having all of these specialists around is a privilege,
It is privilege.
is
Yeah,
elite. It's another level
yeah,
to help you, not hinder
yeah,
you, but help you. So
yeah. But to
yeah,
help you.
yeah, so we are, systems thinkers,
Mhm.
not in a siloed specialist, and we're coming to the end of our episode. I hope that this was something that helped you, that was meaningful. We're here for you. Please subscribe, like us, Balance Steps uh, podcast here, and I am Dr. Cynthia Correa Cedeno, my co-host.
And I'm Dr. Sondema Tarr.
All right, you have a great day. Till next
All
time.
right.
Bye.
Bye.